And so everybody that's ever analyzed this, Barbara Starfield at Johns Hopkins is probably the preeminent researcher in this, has said that if you introduce more primary care into a patient population, the outcomes get better and the costs go down. And we're certainly been focused on quality and improving outcomes, but there's also, I think, a recognition amongst everybody when we see our health insurance premiums skyrocketing that we've got to cut costs. And so one of the answers that seems obvious to us in primary care is that we've got to really support primary care, and that will actually has been proven to reduce costs. So in a lot of ways, not only on knowledge of the patient actually can prevent having to do unnecessary testing. Emergency departments, because of medical legal environments, have to do testing on people they don't know they're coming back, they don't know very well. And I can reassure a patient of mine who I know well that they don't need an MRI, they don't need a very expensive test, whereas a physician that doesn't know that person very well can't do so. So actually, can you just go back? Sorry. So we see all the studies show we have reductions in hospitalizations, we have fewer inappropriate visits to emergency departments with primary care. And so again, I think it's pretty clear to health economists and people looking at this that one of the most important strategies that the country can embark on and the state can embark on is expanding cost-effective primary care. So this is, again, both a Massachusetts crisis and becoming a national crisis. And to give you a sense of this as well, 55% of people going into family medicine residencies this past year were international medical graduates. Only 45% of the programs are being able to fill with U.S. grads. So again, there really is a crisis, and it's going to get worse because what we're also seeing, the recession has actually helped a little bit in terms of physicians are delaying retirement, they're working longer. But the fact is that once the recession ends, there's a lot of discussion about people are going to, because of the difficulties and with administrative burdens, et cetera, retire from primary care. So if you look at the average age of a primary care physician in the state, it's been going up pretty dramatically, over the last 10 years. And many hospitals and health systems are going to have a very difficult time finding a primary care base because we're not replacing or replenishing the supply. In this state alone, we only have about 35 residency positions in family medicine. If you look at how many residency positions are in Massachusetts, again, people think of Massachusetts as really world-class healthcare, and it is for subspecialty care, no doubt about that. But if you look at what's the percentage of Massachusetts residency programs that are training physicians for primary care, which is what the public needs, last year was 2.9%. 2.9% of all the slots going in for this year's entering class in July were in primary care and family medicine. So we're going to be producing a lot of specialists again, but until we change the payment structure and support primary care residencies, we can't expand residency programs. And in fact, Boston University is an example. There's thousands of residents. I'm not sure how many residents. Literally, there are hundreds of residents. I think there are about 100 internal medicine residents in entering class at BU. They have 6 family medicine slots because it just is not economically viable compared to the clinical revenues you can get from the subspecialty care. And I know I'm slow, Mark. And the other thing is, if you just look at the numbers, in 2009, only 60% of family medicine physicians were accepting new patients, down from 65% and 70%. So that's a downward trend. And among physicians accepting new patients, the average wait time is 44 days. So that's one of the success stories of Lawrence, is that our patients are historically not had to wait that long, but we have had, even in Lawrence, a problem with access. We've had 3,000 patients without a PCP. We've just recruited in a bunch of new family physicians that are starting this fall. that will hopefully help alleviate that. But it's very difficult to try to expand when you're also cutting a budget, which is what we're trying to do. We're trying to balance that. So I think this is my last slide. So I just want to implore people to think about supporting primary care, residency training, and graduate medical education. This health center is a special place, and I think most places you go to, they say that, right? But nationally, I was in Kansas City last week trying to recruit residents, and there was about 400 residency programs on this convention center exhibit hall, and it was overwhelming how many people were coming to our booth. It was frankly a little embarrassing because the UMass program was next to us, and the BU program was on the other side of us, and everybody was coming to talk to us about Lawrence. And these are people from Miami and Portland, Oregon, and so we really do have a national reputation. People in Portland, Oregon are saying, if you're interested in underserved medicine, you got to look at Lawrence, Massachusetts. And so, I think I'm very proud to be from Massachusetts when I go into the national meetings, and that I think we did the right thing in terms of healthcare coverage. It's just now I think it's time that we really try to get our workforce in order, because again I think it's going to take some specific prioritization to make that happen. So I thank everybody for your attention. Okay, so I'm going to turn this over to Bob.
Thanks, Bill.
Thanks.
About 5 years ago, we opened our first pharmacy here at this site, which is the main site. And over the last 3 years, we've actually expanded pharmacy services to all of our sites. So all 4 of our primary care sites now have a pharmacy. And not to take the thunder away from the folks doing the presentation here, but so last year we filled 235,000 prescriptions for our patients. Because we're a federally qualified health center, we have access to a federal program which allows us to purchase medications at a significant discount. And we're able to pass those discounts on to our patients who have no insurance. So I'd like to invite Pat Groton, our Chief Information Officer, and Diane Gatchell, our Director of Pharmacy, to the podium to talk more about the program, its benefits to our patients, and how it's improved access to low-cost medications for our patients.